10:05, and we don't have dirty laundry. We just have the president of OSF St. Anthony's Health Center in Alton, Jerry Rumph, with us. How are you doing, sir?
Good.
Did I get the name right?
Yes.
All of you texters at home can't get to me yet. I have been perfect all day with pronunciation.
Yeah.
I guess. But it's been a great morning so far, and we're going to continue that with Jerry. You've been at OSF for 2 years now.
Correct.
And now, before that, what was your kind of background in healthcare?
Yeah, so actually it goes back to, I started actually in the Army.
Really?
So I spent 20 years in the military, in the Army. I did healthcare administration in the Army as well. So when I retired out of Fort Leonard Wood, I moved to St. Louis. And then I spent 13 years with SSM Health and a couple years with Mercy, and then over here to St. Anthony's.
That's incredible. And by the way, thank you for your service, too.
Thank you.
I really, every time we have a veteran, I always thank them because we always should. And it's really cool. So they picked up a gym with you. You had a background in everything that was needed for this position.
Right.
And, you know, OSF Healthcare is just a great organization. We have you guys on quite a bit because there's so many different services that you provide that I think, you know, not a lot of people realize, you know, or maybe there's a hiccup and, you know, a belief. And I, you know, want to ask you right off the bat, you know, what are the values of that Catholic, you know, healthcare system? And can, you know, kind of dispel that. I think people believe that if they aren't Catholic, they can't receive care from you. And that's not the truth, right?
No. And actually, there's the Catholic healthcare systems is the largest non-government provider of healthcare in the world.
Really?
So there's more Catholic hospitals than any other hospital across the world. About 26% of the healthcare facilities around the world are Catholic affiliated. Wow. And you know, the thing that we really focus on is not necessarily about being Catholic. It's really about taking care of patients, the whole person, the body, mind, and spirit.
Yeah.
Because also the spirit piece also helps with healing. We understand the importance of spiritual care in healthcare and for our patients. You know, one of the things that we're proud of, we don't do is we aren't a transactional kind of service. You know, so
can you explain that a little bit further?
Yeah, what that means is that we just don't provide a service and then get paid, and you receive a service and you go on your way. You know, we really focus on the person, the individual, the dignity of the person, what they're there for. Regardless of their ability to pay, you know, so we actually honor that, and we cherish the ability to take care of patients who are underserved or who lack the ability to pay for their health care.
That's incredible. I didn't know that. That's truly incredible.
Yeah. And, you know, it started with the sisters 98 years ago, where they arrived in Germany and they bought a orphanage that's on the original site of our hospital. And actually, we still have original part of that building that they purchased in 1925.
Wow.
And converted it to an infirmary, which then has grown into St. Anthony's as we know it today.
That's incredible.
Right.
And, you know, in the 2 years, I could only imagine just, you know, in your tenure here so far, I mean, every other day I'd be looking back at some of the history of the hospital and the history of the organization because there's so much there. And it's been a part of, you know, Alton forever.
Yeah.
And, you know, I got to ask you, too, something that, believe it or not, when you guys were putting in the Moeller Cancer Center, my family's business was called out, Rigdon Sewer Service, and we went out there and were scoping lines because that was a major project that you guys undertook, and you did it very well.
Right.
And I want to just ask you, though, for people that are kind of seeing the building, maybe they've seen some headlines every once in a while, what is the true purpose of the Moeller Cancer Center?
Yeah, so actually just real quick on that. So what's really unique about St. Anthony's as well is we're part of a large ministry, 15 hospitals. But when it comes to constructing that cancer center, we focused on making sure that it was local trades, electric, construction, all that actually built that cancer center instead of bringing what SSM or OSF might use in Peoria down to do that work. So we really wanted to keep that money that we spent. I think it was over $10 million for that building in our local community.
That's fantastic.
Yeah.
And truly, thank you for, I think that's one of the most important things to do is stay local and make sure we're supporting our own.
Right. But there's a lot of stuff happening at the Cancer Center. And one of the things that I think is unique about our Cancer Center is the fact that we provide all of our cancer services locally. So it's in that building. So you don't have to travel across the river to get radiation or to get any other kinds of services. We have a medical oncologist. We have radiation oncologists. One of the things that we have that's unique as well is we have nurse navigators. So we have nurses that are focused on the patient and helping them navigate their way through the process. We have a specific navigator for breast. Then we have a navigator for the other cancer diagnoses and tumor types. And they do a lot of work behind the scenes. One of the things that they've been working on, this is a great project that always gives me goosebumps thinking about it, is one of our nurse navigators, they actually go through all of the radiology reports that are done in the ED or anywhere in the hospital. And if the radiologist identified an incidental finding, that's not necessarily what they're looking for, that's a nodule, a spot, or anything on the lung, we follow up and we make sure that patient gets imaged, they get followed up. And every week I see the numbers. And every week we find 3 to 5 new cancer patients that may not have been diagnosed because it was an incidental finding on their radiology report.
That's incredible.
Right.
I mean, that is seriously innovative, and that is so helpful. And you got our text line blowing up,
right.
too. I know, it's a good thing.
Yeah.
I'll read the text later.
Yeah.
But, a little bit more about this. I mean, what I love is I had Heather Chambers on, who is in the center, and just to hear her passion, for what she does every day, it just symbolizes what OSF Healthcare is, and that's passionate to help serve us and help us with our health and lifestyles. And you guys do such a great job.
Well, the women who know Heather know she actually stands and holds her hand when they're getting a biopsy. That's the kind of service that her as a breast navigator does. She's with the patient along their entire journey, to include at their side, holding their hand during a biopsy to help them be a little bit more comfortable.
And another thing that I want to highlight real quick before I move on a little bit is the fact that like you said, you aren't going to, if you're going through a battle of your life, you aren't going down the road and then across the bridge and then back to a hospital to receive all this. It's all in one place and so beneficial.
Right.
And I wanted to kind of recap a little bit the affiliation, the strategic one between you guys and SSHIM. Can you kind of go into that a little bit deeper?
Sure. Actually, I like to use the phrase care close to home, because that's the concept we built that partnership on, where actually SSHIM is bringing providers to our community versus us sending all the patients across the river to St. Louis. And so we've worked on partnering to provide that more comprehensive care locally to our patients. So our first initiative was cardiology. So Dr. Kumar, he's a professor at SLU University, works at SLU University Hospital. He actually is here full-time, and he is our cardiologist, of course, so he provides all the cardiology care. But he has a specialty that is unique. Not every cardiologist has. So he's an interventionalist. He does procedures like most cardiologists, but he also has an expertise and extra training in what we call limb salvage, meaning it's peripheral work where he can go into the lower extremity, your legs, and clear some of that flow of blood. And he has actually some great stories. We have actually a patient that got referred from Litchfield.
Wow.
So down here, and all they could do up there, they said they were going to amputate his leg. And he said, I want to see if somebody can save my leg. They sent him to Dr. Kumar, and Dr. Kumar saved his leg. And so the patient came back for a follow-up, and he was so excited. He was, jumping up and down and looked like he can walk, because it's life-changing, the difference between keeping your leg or being an amputee. And Dr. Kumar does that peripheral work here, and it's just really awesome. And it's just great that we can bring that level of expertise to Alton. I just got to ask you, too, I mean, especially in your position, to see all your, the individuals that work under you under this OSF healthcare umbrella, is there ever a point in the day where you just kind of sit back and go, I can't believe all the great stuff we're accomplishing every day? I was actually, when I went home last night, I was a little exhausted because there's so much stuff that's happening. We have a lot of things in the works with SSHIM as well. We actually are finishing up and just getting ready to kick off a telestroke. So DePaul and SLU DePaul is one of 2 comprehensive stroke programs in St. Louis, and meaning that they do advanced stroke care. So right now we have, we're rolling out what we call a telestroke program, which will be able to get a neurointerventionalist from DePaul on the line through a virtual system to be able to look at all the stroke patients coming through the ED, if they're candidates for intervention, meaning intra-arterial TPA, clot retrieval, coiling, then they would take the patient, we'd ship them straight to DePaul. It reduces that delay in getting a transfer done, getting a hospital to accept a transfer, and they get straight into the interventional suite, and every minute counts when it comes to a stroke.
Absolutely.
And so this program, the telestroke program, is not new to DePaul. It's new to us, but they were talking to me about how many patients were able to, after they left DePaul, after their procedure, was able to walk home. And that's amazing after having a stroke and being able to have little to no residual because of the fast work that they do at DePaul. In addition to that, we're going to move in using that same technology in ED, is working with Cardinal Glennon Children's Hospital to have a pediatric ED physician available for consultation, because our goal is to not send kids and their families to St. Louis, especially at night, to wait in their waiting room and then just to be sent home after they're treated. If we can do it in our ER with a pediatric ER physician that we're talking to through this technology.
That's incredible.
Right.
I mean, that is, and as somebody, not a lot of people know this, but I have nephews and I have, nieces, and, that we had a terrible, tragedy a couple of years ago, and just to see the trips back and forth and seeing that, just the toll and how it wears you down, able to have that type of service just to help bridge that gap a little bit and create some sort of, just take it easy, we'll get into this virtual, and then we'll see where we go from here, instead of driving an hour, getting sent back, driving an hour home after waiting maybe a couple hours, to be seen sometimes. And that is so awesome. I mean, that is really innovative.
Right.
And now, is there anything else too coming down that kind of strategic affiliation pathway?
Yeah, we actually are coming very soon. We'll be opening our pain clinic with a fellow trained pain specialist, anesthesiologist from SLU Hospital. And then we're working on partnering with orthopedics with SSM as well.
Wow.
So those are the things that are in the near future that we're working on currently.
That's incredible. And, I just think it's so important, especially with pain management, because I don't know if you know, I do pro wrestling. Really? I lose a lot. I have to throw a disclaimer out there every day of the week. But, I travel the circuits and get hit with the steel chairs and you go through the table. But, no one realizes, just from my experience, how just some of those injuries can lead to so much substance abuse because of painkillers and things like that. And to have a pain management specialist right there that you guys are bridging the gap, I mean, that's huge.
Right.
And that could really be a big, hopefully a big help to combating this opiate crisis as well.
Right.
That's really awesome. I mean, really cool. And I got to ask you, I've heard some things about a wound clinic as well.
Yeah. Actually, we're opening up a wound clinic in the near future. And we're also going to be opening up an inpatient stabilization, detox medical stabilization program as well. Wow. And both of those, we're partnering with some national organizations that are leaders in those fields to be able to bring that expertise to our hospital to provide that care.
That is so cool. I want to ask you about this real quick, though, because of all the things you've done. Did you think in 2 years that you guys would be accomplishing this much seriously? Because we've said, you see the development, but to really just look up and go, wow, in 2 years' time of being in this position, we've been able to accomplish so much.
Yeah, it's truly amazing. And I think the couple things there that the testament to the partnership with SSM.
Yep.
The leadership for OSF, at the higher ministry level that supports us down here in Alton. But also, it's really our mission partners at St. Anthony's. They are just so dedicated, and they're so motivated, and they're creative, they're energetic. Our leaders are smart, and they're taking on these projects and really making these things happen. And I don't think any of this could have happened if we had a different team than what we have.
Without a doubt.
Right.
Without a doubt. And what I want to highlight it real quick, too. You guys are so organized in the way that you guys develop things, the ways you guys work together, that it really is just, it's fascinating to see the process, because I've never seen a hiccup in any development. It's been straight to the point. You guys are always getting things done. You're always communicating and keeping us informed while you're doing it, which is not easy.
Right.
I mean, that's not easy at all. And now I also saw saw too, kind of circling back and making sure I stay on track here, Jerry, because I take a couple of chair shots and you're in Kansas by 12, you know. But I want to ask you about the inpatient detox unit, because now this is something that I think is truly incredible that we all need to hear about, because we all know somebody going through something terrible. And maybe this could be a great way to help bridge that gap and help, start the process to a recovery or to a better tomorrow.
Right. Yeah, and the program's called New Visions.
Okay.
It's a program that is offered by a company called Special Care, and they do this across the nation. One of the great parts of that is not only are we providing the medically supervised detox withdrawal program as an inpatient, so they get to come into the hospital and go through that process, but a big part of the program is finding them a place to go after. Yeah. So they have a 96% success rate in getting those patients from discharge into a program and then making at least their first meeting or their first visit into those programs, which is great because that's the key. It's not just getting clean, it's getting clean with a program that's going to help you stay clean.
Exactly.
Right.
That's truly, to me, out of all the things we've talked about today, the moment I saw that, I went, so many people could be helped in this area. And, because I know individuals, we all do, that have gone through this. And, it seems like, when that happens, it's like, where do we go? Who do we take, where do we take them to if we have to really, intervene or something needs to be done? This is perfect. I mean, and not just perfect for the support groups. It's perfect for the individual because, like you said, it's not just getting clean. It's staying clean on a program that keeps you motivated.
Correct.
And out of all this, what are you most? I mean, this is like the 60 minutes portion of this interview. What's the most excited? What are you most excited about in all of these programs that you're? I know I'm throwing you on the spot here.
Well, I think I just think all of the work where we're bringing providers from St. Louis to our market instead of our patients going across the river. And
huge.
We've heard the voices of our community. They don't want to go into St. Louis. It's scary.
Yeah.
It's a lot of work to travel to and from, and with gas prices the way it is, it's expensive as well.
Yeah.
I think that's the piece, and I think what's great about it is the providers that we're working with in SSM are all excited to be a part of this process. So they're not just looking at us as another department or another, business. It's really, they're very engaged, and they're actually see the value in the relationship.
It's not a one-way street.
Right.
And, so many times when you're talking about this, and I just think of all the situations, that I've been through so far with loved ones, especially as you get towards the, the end of life stages with strokes, TIAs, and things like that. And just my nephews and all these other things, just that component of bringing that, larger group over to us instead of us fighting 270. And I mean, I hate to, I'm not joking about it. I mean, it's dangerous to drive over there. And you guys are giving us that opportunity with this partnership. It's something that really just puts a smile on my face and makes the hair on my arm stand up a little bit. Yeah. And now I got to ask you, we've been talking so far for about 20 minutes or so. And I know I always tell people 10 to 12, and it goes 30. It happens. What's the plan in the next 2 years for you guys and your tenure as president of OSF Healthcare St. Anthony's Health Center?
Yeah. So one of my goals is to make sure that we're relevant in our market, and that means we want to be able to provide the well-rounded complement of services. The thing that we don't offer is OB, which we got out of that service a few years ago, but we want to make sure that we're providing all the other services at some level to our community. So I think the continuation of this partnership and the growth, that potential that we have, and more providers introduced to our market is one. And I think the other piece is really maintaining the mission and the culture of St. Anthony's and not losing focus of why we're here, to heal the sick, and that's the healing ministry, and really keep our mission partners engaged. I just want to throw one thing out.
Oh, please do.
So we're one of 15 hospitals in our ministry. And every year we ask the mission partners about their engagement. How satisfied are you with your job and the work you do and safety and all of that? We have the highest mission partner satisfaction in the entire ministry. That's
seriously something to be really proud of.
And we are the only hospital in the ministry that has no agency. So most hospitals, even in St. Louis, are struggling with the fact that they can't hire.
Yes.
So they have to supplement with what we call agency staffing. And we've eliminated agency because people want to come to work at St. Anthony's because they've heard about us, they know our mission. And I ask new mission partners when they come in, we do an orientation, why are you here and why did you think about St. Anthony's? A lot of them said they were either student nurses here or they knew people who worked here and they heard about how great it was. And that to me is just really the driver, because without that foundation of engagement and people wanting to work here, we really can't achieve all of this because we chase our tail with trying to get staff on board. So that's exciting to me. And I think if we can maintain that going forward, we have nothing but this blue sky, to reach for.
And you know what? And when you guys are successful reaching for that blue sky, the entire community around us is successful too with our healthcare needs. There's no better way to wrap up an interview than that. I mean, I don't know where else to go with from there. I mean, that is seriously a statistic that you have got to be ultra proud of. And all I got to ask you, sir, is that in a couple of months, whenever all these new innovative programs start coming, you got to come back and fill us in. It is 1026 right here in the heart of the Riverbend, downtown Alton, on this 9th day of February. Jerry Rumph is the OSF St. Anthony's Health Center president, and it's been a great conversation. So many of you guys texting in. We thank you for that. I was just too focused on our conversation. But coming up, Bill Detmers, we're going to talk to a candidate for Wood River City Council, the municipal elections in April. We start the trek next after this.